Welcome to Budget with BWR. Today we decode the anatomy of the budget with respect to the healthcare sector. We have with us Professor Ratan Kumar Pandit, Assistant Professor, Jagdish School of Management, Greater Mumbai. Before coming to academics, he has worked for 8 years in the industry in the marketing and sales roles in the pharmaceutical as well as tourism sector. He has presented his research work in top international and national conferences, including the AMA Summer Conference 2018 in Boston, USA. Welcome, Mr. Ratan Kumar, to Brickwork Ratings Podcast.
Yeah, thank you, Tina. Thank you, Let. I'm happy to be here with you.
So, before we delve into the post budget analysis, could you give us a brief up on the key policy announcements specifically which was related to the healthcare sector?
Okay, if you see the overall budget of the which is recently announced by Mrs. Nirmala Sitharaman, that the focus of the healthcare, the budget allocation has not much increased compared to the final budget which was there in announced in December 2021. So there is very little increment is there. However, the focus is shifted towards the digitalization. The some of the key initiative like digital national digital health mission, which is focused on digitalizing all health records, not just health records, but putting the entire health infrastructure, whether it is the registration of the patients, whether it is the infrastructure in terms of healthcare, the hospitals, the primary care, or the diagnostic part. So all will be on the digital platform where it is kind of a providing a single window system to the patients. So which is a very great step by the government. So now the focus is on that. So it's like the balancing the focus on the digital part, on the mental part, on the rural and the people who are not able to access the healthcare. So it's like a focus on that part. So it is quite a good and encouraging step from the government side.
But cutting to the chase, given this post budget scenario, how has the budget actually fared in your expectations? Do you feel it is a letdown for the industry or it's merely a realignment of priorities?
It is kind of a balanced. If you see, like for example, this the focus on the if you divide the budget, it is like the next that national health mission or the Pradhan Mantri Suraksha Yojana. So all kind of the outlay which is there for the people who are not able to afford or access the healthcare. Okay, so that kind of the key central government schemes. So there is a little increase in all of these, and along with the digital, the focus on the digital. So the digital itself will create a lot of not just the job opportunity, but the streamline in the system, and it's a big opportunity for the hospitals as well, where there are it is specialty is called the capacity utilization. There are hospitals or maybe the facilities which are underutilized, and there are facilities which are overutilized. Now coming to the streamline of this, that will help that in one way to use the capacity at maximum. However, coming to some of the things which could have been enhanced is one area is the focus on the R&D part. The R&D part, because India is considered to be a R&D hub for the company. The foremost companies, the big companies are also having their big R&D centers in India. And not just their own center, there is the contract research. Contract R&D is a huge revenue source for India. Now, if there is some incentive to this industry to part, so that could have been another very good advantage. And another is which could have been thought full area is the skill development in this sector. The skill development in this sector, especially because the coming of this new technology and coming of the new challenges which is happening in this sector. So there is still need to have a balance or a focus on the skill development part, where government could have set up something or could have provided some incentive towards that, so that all the people, all the healthcare professional, whether it is the physician, whether it is the nurses, or whether it is the other people in the diagnostic, or that they could have been skilled in a upfront way, which would have finally made all things easy and accessible, and it could have a like provided a better manpower to the healthcare system.
Yeah.
That to
I
be
think
more
you voiced
precise.
my next question, which was like there was actually no provision to allow designated weighted, deduction for R&D spend, like you said, for pharma companies. So, do you feel that the healthcare companies were disappointed with this particular aspect?
Yes, that is one is yes, that rightly said that they are, because when before the budget, so there is this organization of pharmaceutical industry, pharmaceutical producers of India. So they jointly put this as a demand for that to increase that up to 200%, that weighted average, that reduction, so that they can have more incentive to focus on R&D part, and that the same drugs which are developed outside, and because the Indian industry is still not able to get a lot of breakthrough medicines. They are more focused on the medicine which are discovered either in the Europe or in the US, and here after the certain years they get the license, and then they do. So it is still the production oriented Indian pharmaceutical industry. So maybe the focus on something like this, where they can incentivize the system, so it could have been shifted to the R&D system, where the companies look have a lot of more incentives to spend that extra money on that part. So that's rightly said. That's the key. Even that uh, still that the a little bit area of concern for these industries.
Yeah, even with the ongoing pandemic, I think it is very important for R&D to get a boost. Coming to the digitization part, do you see the implementation of the national digital health ecosystem? Is it taken well by the rural as well as the semi-rural segment of India?
See, if you see the entire the pattern of these things, this national digital health mission. So there are different stakeholders involved. One is the government. The it has its own. It will get a lot of things. It will the first with the national digital health mission. It will get the real data of what is the real in the health infrastructure in the government or in the whole country. The second is the hospitals, which are either overutilized or underutilized, or there is some lacking is there, which and we may have seen in last 2 years during the COVID also, there are many things which are not transparent on the hospital sides or the healthcare service providers. So what are they being promised during the initial time of the admission in the hospital? They are not being provided in that, or they are being some in the marketing term we call the service. So the service which is promised may not be delivered. So then comes the diagnostic centers, which are also there is, if you see, there are repetition of diagnostic in a lot of cases. The same the physician, the diagnostic is done 10 days before, and the same may be asked after when the patient is coming to the next physician or next hospital. And then the fourth stakeholder and the key with the center point is the consumer, or the common people of India, who will be using this system entire thing. So it is a huge transparency for them, that now they will have a clear idea that what they will get, what are the things in which, and from the government side, they even can make policy around that. They will get a clear idea is what is happening in their healthcare system. So accordingly, they can formulate the policy. So it is a like win-win situation for all. But the thing is, in the starting year, it will have some pain points. The one of the key pain points is the infrastructure. If that's the area which you just mentioned, the rural areas and the semi-urban areas. So one of the key thing is the this internet or optic fiber connectivity. Though with the coming of the new these telecom players, so internet speed is little increased, and there is a competition. So the rate is the price is also low. So it has basically increased the penetration of the telecom. So which eventually is beneficial for the this digital health mission. However, still there is lots of challenges there, because the kind of the bandwidth and the kind of the speed which is required for such a system to access, say for example telemedicine, which will be also a part of the system of this digital health vision. So that require a huge kind of the speed and a proper infrastructure, which is still not there in the rural area. So that is so though on the government side there is another thing, that the 5% of the universal fund that they have allocated for to develop this optic fiber infrastructure in rural and these areas. But still we need to see the implementation, what is being announced and what is being implemented, how much time it will take, how much time. So that need to be looked upon.
So there's lots to cover up, I think, in the next few years for the government. Thank you so much, Mr. Ratan Kumar, for giving us your opinionated take on the healthcare sector. And it was great having you.
Yeah, thank you, Tina. It's great.